My name is Lawal Bakari. I lead communication at the SWAP Coordination Office, operating under the Federal Ministry of Health and Social Welfare. We've put together this platform. It's called NHSRII Check-In, but we are operating it under the SWAP TV. The idea of NHSRII Check-In is to create a platform for those who are leading some of the edge of the reform in the health sector, to come and give us what is going on and what are the things that Nigerians should expect. Where do they expect Nigerians to pick up new behaviors or pick up new services, where those services have been made available across the country, and also uses to share feedback that we are receiving across our different platforms with them so they can respond to some of them, and also just share hope and tell us stories about themselves too. These guys are real humans. Some of them are very funny people. You see them out there always prim and proper. Well, let's just poke their personalities a bit just to make the environment kind of more exciting and fun. Today, we are having our first ever guest on the show. He's arguably one of the most active in the reform. A fine gentleman from Bayelsa. His name is Dr. Doubra.
Thank you very much. Thank you very much, Dr. Lawa, for bringing me to your platform and making me the first of such a great initiative under the SWAP office. I've known you to be an innovator, a crazy type, but you've been able to create things that even when we doubt you, we see the light in what you're trying to do. And being part of this innovation, I'm sure we'll be able to showcase and inform the public in the lingua that the public understands, and be able to communicate properly and let everybody know where we are going to. And on this note, I want to appreciate the SWAP office under the leadership of Dr. Muntaka, then the coordinating minister, especially for bringing this innovative platform. This coordinating office is very important to lead us, given the complexities of governance and his understanding of the health sector landscape in Nigeria and how to surmount all expected challenges when it comes to policy reforms. And I'm glad to be one of the pillars as the National Program Manager of NEMSAS. So before we go into conversations, I'll hand back over to you.
Let me start with something very exciting. The afternoon that Anthony Joshua had an accident, where were you?
Actually, it was during the Yuletide period. And, sorry to say, as a doctor first and as the lead of emergency medical services, you're supposed to be alert always. But right. I won't lie, I was just relaxing with friends and I saw something like Anthony Joshua had an accident. And it first started like a rumor. Like, I didn't expect it to be a responsibility of mine. I'm just being realistic about it. Then I realized, this is emergency medical services, something that falls on my lap. So I had to immediately call the Ogun State coordinator and ask him what happened. So he gave me an update. And I knew, like any other emergencies, when it happens, everybody comes to for government first. So I immediately convened an emergency meeting of all coordinators to get the feedback or get their own inference on what they felt should have been done right, where the gaps were. So we did a quick assessment of the situation, had good information on good input from the Lagos State and the Ogun State NEMSAS, but it was an unfortunate event and it really exposed some gaps in first the knowledge of emergency medical service across the whole public, and it's a trust deficit we have amongst our people, right? So I don't blame the issue of trust deficit or pessimism across the people. It boils down from a history of some gaps in governance. But the present administration have tried to reassure the people, creating policies that are people-centric, especially my program, NEMSAS. And we don't want to throw blames on the Anthony Joshua situation, but public education is very important. The people need to understand what we need to do when there's an emergency, right? And we need to make sure the enabling infrastructure are made available for the managers of emergency across the ecosystem, EMS ecosystem. So in Nigeria, I can't say the EMS ecosystem is fragmented. communication is different from response, right? So communication is under the purview of the Nigerian Communication Commission, which national,
yes.
that so they are the national body that established the emergency communication centers, which serve as emergency coordination hubs across the country. Now, these hubs manage the 112 emergency number, like abroad, we have 999 and 911. But from a recent survey conducted by the NEMSAS office, which I head, and the first cohort of the Nigerian Health Fellows, we're able to get a real picture of the functionality of both 112 and emergency medical services. And opposed to contrary beliefs, contrary to people's belief, there's availability of this 112 network across 80% of the local government. But the challenge there is response on first dial. Because, when people are within emergency situations or people are faced with emergency situations, everybody's apprehensive and you need a response as quickly as possible. It would be so discouraging and scary when you call a number and you get a missed call or you
just return back. It is not trustworthy.
It's not trustworthy. So that's the issue.
I started with this because I feel it's a very recent, fresh, and every citizen connected with the event, locally and internationally. And then we can use that to establish where we are coming from as a country. I have been a victim of road traffic accidents like twice. One, I was personally involved. One of my colleagues actually passed in that event. I was in medical school then.
Sorry.
And I can remember we couldn't get an emergency vehicle in. This was early 2000s. It was a lot. We lost some very good friends that year. We eventually got moved in a pickup. We moved in a pickup. And the only reason we could stop that pickup was because it was a federal government vehicle. So, people that came to help had to stop him and say, look, if private vehicles will not pick them, we'll use a pickup. Just imagine someone having medical emergency, kind of bleeding from their ears. And that was how we moved them. Then fast forward about 10 years after that event, as a matter of fact, I had an event in Lagos and it was equally like a stampede. And then this one, we had good ambulances. The response time was fairly good. But then we faced an exciting scenario. Nobody was willing to leave the road for an ambulance. So the siren kept on blowing. And then for once, I had to pick the microphone in an ambulance and I was announcing to people in the traffic that, please, we have a medical emergency. Could you please evacuate the road for us? And it goes to show that this is a platform that is open for reform. So if you don't mind, can you speak to us like where we are starting from? Because yes, you can look at the problem just for problem's sake, but this is an ongoing reform that allows everybody to plug in. So where are we even starting from? Where are we as a country?
Okay, so first, I think I have to start with saying I am Dr. Emuren Doubra, the National Program Manager for the National Emergency Medical Service and Ambulance System program. So NEMSAS, as the acronym goes, is the operational arm of the National Emergency Medical Treatment Committee. This committee is established by the National Health Act as the vehicle or the organ for administering the Emergency Medical Treatment Gateway Fund of the Basic Healthcare Provision Fund. Now, as a committee, which I'm also the secretary to, this committee has also been saddled with the responsibility of ensuring that Nigeria has a structured and standard emergency medical service system. What I mean is it has a pre-hospital system, which is the ambulance service, and also has some standard operating procedures for in-hospital stabilization and management of patients, as well as manages emergency medical services of funding for EMS care for indigent and vulnerable patients, because lots of people are the out-of-pocket expenditure for Nigerians. So in addition to that, you provide this emergency care for indigents free. And also NEMSAS would soon, we're on the verge of serving as a conduit for these indigents to get insured. So the partnership with NHI, which we are planning, we're curate is system where once indigents are covered under NHI at first contact, we now hand them over to the health insurance for them to also be insured. So for emergency medical services in the country, NEMSAS has done a lot by first help supporting states to set up emergency medical service structures.
Oh, so it means states are expected to have their own emergency medical service.
So now the funding we have under the Basic Healthcare Provision Fund has been appropriated or set aside to pay for ambulance services across the country, irrespective of your financial capacity or your social status. So once you have an emergency and you call the 112 number or some state designated emergency numbers, we pick you up at no cost to the patient. And take the patient
from anywhere within the Nigerian geography.
Anywhere within where this NEMSAS program is operational. Now, what we do as a national body is to support states to set up their structures. NEMSAS on its own has no ambulance. We don't run an ambulance service system, or we don't have a facility where we serve as implementers or providers. But we are standard setters, and we are the overarching system or overarching body that supports states, guides states on the standards for setting up these systems. So far, 33 states and Federal Capital Territory have been supported to set up the structures.
So that's 33 plus that's 34.
34. So we have 3 states that are yet to set up. Recently, that's Kwara, Benue, and Imo. Recently received an expression of interest from Kwara State because the eligibility criteria and the rate limiting step is the entry point is when the state expresses interest. That shows some level of ownership and seriousness. And it's a positive indicator to show, okay, they are buying in and they will surely support. So Kwara State recently, last week, we received an expression of interest.
2 months ago.
2 weeks. So 2 months ago, but
I mean,
two more states to go. But what we do, we don't wait for states. We don't want any part of Nigeria to be disenfranchised. We are fully cooperating or fully partisan to this reform. And by that, we also register and onboard federal tertiary facilities. So for these 2 states that are yet to be onboarded, Federal University of Health Science Teaching Hospital, something like that, in Otukpo. The Federal Tertiary Facility in Otukpo would serve as the interim coordination hub in Benue, while Federal Medical Center Owerri will serve as that for Imo. This is just an interim measure, pending when the states come on board. So what we can say now in Nigeria is all states are covered and no state is without NEMSAS support. Now, I always say this. It's one thing to set these structures up. It's another thing for the people to be aware of these structures and now benefit or access this support. And what is that? We need to do more advocacy, like what we're doing now. Getting people to understand through SWAP TV, through this innovative program of yours, we can now get people to understand, see, come on, this is available for you.
So if you have emergency, anywhere in Nigeria,
go to the federal tertiary facilities. There are a list of them that I'll give to you, which will be posted on this platform for you to know. These federal tertiary facilities accept walk-in emergencies. But first, it has to be established that you have no ability to pay. So I also encourage Nigerians not to be deceptive, right? And try to game the system by drawing down funds that are meant for the poor and vulnerable when you know you have the ability to pay. Because you are shortchanging another indigent person. So now that's what we have.
So let's put this in proper context. We now have an emergency medical management service across the country.
Yes.
So emergency medical service.
Yes, please.
Across the country. Either through the states or the federal tertiary facilities in some states. This infrastructure is accessible to all Nigerians.
Yes.
It is either you can afford it, so we expect that you have an insurance. So through your insurance and somewhere within your insurance package, you should be able to access service because supply is fairly available across the country. Now, in terms of the demand, either you can pay for it through your insurance, or if you are absolutely indigent, that means you don't have a kobo, you can't afford to pay any kobo from your pocket. The service is able to identify you as a vulnerable person and will still cover you.
Yeah.
Okay, that's exciting.
So for ambulance services,
So that's
it's for
on the
everybody.
supply now. So
Supply.
can we talk about the supply? What's the level of availability of the ambulance services?
So now, so as I was saying, for the ambulance services, just to chip into your last point, ambulance services for everybody, irrespective of your financial status. You get that free at no cost to you. Now it's the in-hospital treatment that has to be either borne by the patients, that the clients that are buoyant enough or are not within that poverty
So that
line.
removes that assumption that you get to the hospital, doctor is asking who is going to pay for whatever.
So just doctors treat, especially, and I say an unconscious patient is an indigent patient. If Dangote is unconscious and they pick him on the road, he's indigent till he can be identified, a relative of a rich person. So don't have to wait and say, before we used to have them turning patients around, so there's nobody who will pay. Now NEMSAS is a guarantee payer.
At both public and private facilities?
Only empaneled private facilities that express interest. Because we pay, we reimburse using the NHIA, National Health Insurance Authority tariff, and some private facilities are not willing to
where we can find the list of those facilities, or can you give us
a list of the facilities? First, all general hospitals within the states in Nigeria are to be, once you are within that state, within the 33 states, all secondary healthcare public owned facilities are NEMSAS a panel facilities.
At least almost all local governments kind of have one.
And the major federal tertiary facilities, for instance, UCH Ibadan, National Hospital Abuja, FMC Jabi, right? Moduba Dama University Teaching Hospital, Dadamawa. So those are facilities that are already benefiting. One, Usman Danfodio University Teaching Hospital, Jos University Teaching Hospital. So those are UBTH. So now another thing is, some of these federal tertiary facilities have been onboarded but are not yet operational. So it's a subjective decision. As I've onboarded you, but maybe you're trying to fine-tune your structures, fine-tune your understanding, build understanding across your accident and emergencies. You are yet to commence.
I think one useful thing that can begin to happen is the social side of this. Because this is where the citizens pick these opportunities up and begin to first just share, right? Let the next person know that, in the same way we tell ourselves about, every other thing. Oh, where can I find the next restaurant to eat here? Oh, there's one down the road. I think just being able to socialize it amidst ourselves as Nigerians is going to go a long way. And then from the institution standpoint, so you said something very important. It is not like 100% of hospitals in Nigeria are under this scheme, but every hospital that cares about patients, because that's why we all went to med school, that's why we are here. Being able to say, look, patients unconscious, you don't have the scheme that you can use to say, okay, take the patient in or not. Know the facilities that are nearest to you, where you can guarantee that if you take the patient there, there's going to be service. That's one. Of course, the ambulance operators also need to know that, okay, if you're an ambulance operator, you pick a victim of an accident or whatever form of emergency, you should know the nearest facilities to you where you can take these people to. And then lastly, again, within the social construct, I'm a local government chairman, I'm a politician, I'm a businessman, I run a bank, and somebody falls in my banking hall, right? By now, I expect that all banks should list the closest general hospital to them. As a matter of fact, safety units of organizations should list the closest general hospitals to them, so that even if not your staff, somebody falls in front of your facility, in front of your business, we can begin to play this joint social responsibility to one another as citizens, so that, you may not know that person that fell is a relative. When I was in high school, there was a massive accident that happened right in front of my house. And one of my very close friends was in the vehicle. The dad did not know that his son was there. This guy just instinctively ran to help the victims. Brother, his son was in that vehicle. So that's two levels of shock, right? Right? Okay, you are there, adrenaline just to get people out. Then you meet your son, one of the victims. It was a serious accident that year. I'm sure the guy might be watching this. He will know what I'm saying. So, on the line of advocacy, I think you should speak to us as Nigerians how we should take advantage of this as individuals, as households, and as a community, because this is what it now implies. You've done the work. I know how much it took you to get all most of the states ready. Ambulance service providers, you've gotten NHIA engaged to say, okay, we'll insure. And where there's no insurance, BHCPF is also saying we'll cover. You've done everything at least fairly well. So it's time for Nigerians to know how to socially utilize. It's not just hospital care. It's basically saying also take responsibility. What do you recommend?
So I think we need to have more conversations with different sectors within the society. Like you well mentioned, the banking sector, the entertainment sector, the hospitality sector, because this is where people converge, people come to. Like when I was in America, I was in one restaurant and I saw a certificate that a certified CPR specialist is here. So how can we have safe industrial buildings? How can we have safe public buildings and private multi-story buildings? So we have AEDs, defibrillators well positioned. We have trained staff on EMRs, on CPRs and basic life support. And also, I was thinking of creating something. I just spoke with somebody today, Dr. Cyril. He's also an actor within the ambulance service space. And he was telling me something about marshals, like how Federal Road Safety Corps have marshals. So within emergencies, they can speak into action.
Very good.
So how can we have NEMSAS marshals across all states?
That's a social call.
It's a social call for you to be a NEMSAS marshal. You trained as you have basic life support training, you have advanced trauma life support training. You always have like a first aid kit in your car that is well certified, and nice. Every month we confirm that your first aid kit is so. Whenever you see an accident, you serve as a first line triage officer.
Correct.
Where you see people confidently swing into action, wear your NEMSAS marshal vest, go in there, put the call straight to my office, because
now you're closer.
Now you're talking to me. You're not talking to, if the 112 is not functional there, or the state communication number is not functional, you're putting the call straight to my office, and I'm ensuring that I help on my own end and call back end facilitation, while that marshal also front end marshal. So he doesn't have time for communication. So now the NEMSAS call center helps him with communication while he starts triaging and stabilizing.
You know how beautiful this can be, that I'm on my way to work with an accident, and I know that my workplace understands that because I'm a NEMSAS marshal. I look, there was an accident on Third Mainland and I had to wait to respond to it. And the entire organization even gives me additional kudos for using their time, to contribute to social good. I think whenever this is ready, sign me up.
I'm going to sign everybody up, all my doctor friends, my alumni, everybody, because it's something because this is, and the way we work is a decentralized system. So we encourage even the state coordinators to lead. It's just for us to lead. And it can be a swap initiative, right? Let's work. I'll speak to the NEMSAS as a program.
The whole of health sector.
A whole of health sector. Society, get NEMSAS marshals. We can start it tomorrow.
Just imagine the Oba, the Oba of Benin saying, like, from the palace, I'm going to decorate all the NEMSAS marshals that
marshals.
are under the
Yeah.
Benin Kingdom and just been able to. That goes a long way. The religious
It goes a
institutions
long
too.
way. It's not people you don't necessarily need government to buy things. You swing into action normally.
Right.
You're a medical doctor, you are a nurse, you're a health worker, you're a paramedic. You understand the ABCDE of emergency management. Another thing is a good Samaritan law.
Mm.
We don't have a good Samaritan law in the country. And
So now you are
that-
Dr. Doubra, you are learning in a new space now. That's
Yeah.
legislation.
We need a good Samaritan law so we can protect first responders or the public when they intervene. Because you intervene and something happens, you are liable. Because there's no good Samaritan law protecting.
You are the only one
the only one there. So although we'll create NEMSAS, we'll still go on to create the NEMSAS Marshal, but we also advocate for a good Samaritan. And NEMSAS is a program. So we are limited by our nature. We're a program under the Coordinating Minister's Office. And because of the importance of this program to the minister's reform, the minister provides direct oversight of this program. It's not embedded under any department. Yes, we've had that arguments with the civil service where they say, no, every program needs to be under a department. But when you have special projects like this, like the SWAP, like the Base Healthcare Provision Fund, that are main enablers and key to the reforms, the minister oversees it. But we still report through a director in the minister's office to the permanent secretary, get the administrative and accounting oversight we have. But we still get our job done, right? But now, policy-wise, we need some level of high-level intervention, high-level input into our legislation, our legal framework. So we have the enabling institutional framework and legal framework to do more. Yeah, to do more. We need to do more because we are limited based on framework.
I think that speaks to like some of the first set of things that you kind of you're asking Nigerians to do for you, because legislators represent the whole of society. They're like our representatives in the creation of the law that govern the society. So I think we'll take that to say as an advocacy effort, and let's see how we can all rally around NEMSAS to do more. And then two more things that I would like to ask you or share with you. Want you to share with us rather before we leave. The first is around what should we expect? Like what is next? What should we expect in the next 3 to 6 months? Let's keep the timeline short so that we can bring you back again when you are done delivering those. What are the 1, 2, 3 things that we should expect in the next 3 to 6 months?
Yes, so we need NEMSAS to have visibility, right? And we need the public to actually see this ambulance working. I know I've started getting some feedbacks and some response and some testimonies from my friends and colleagues. Oh, I saw this ambulance. I saw an ambulance respond. This was never the case before. It was an impossible act for you to see an ambulance respond to an emergency. So what I'm expecting and what I'm working towards is equitable spread of ambulances across local governments to start with. And how do we do this? Not for federal government to procure ambulances, but bringing private sector into the net. Getting private sector into the ambulance service architecture, the hub, so we know. And one thing we need to do, and that's what we're already on the verge of doing, is putting forward cost-reflective ambulance tariff with government pay. Because we understand the plight of the private sector. The capital investment is theirs. But for government, they have to recuperate. But the government, you procure the ambulance is an issue. So how do we create a cost-reflective tariff that will encourage private sector to invest in procuring ambulances and preposition ambulances in, and also have an evidence-backed dispatch system or evidence-backed ambulance allocation system? So presently, NEMSAS has commenced the utilization of our NEMSAS Connect, which is our digital dispatch and claims reporting tool. So digitalization is my main goal, main mission for this 2026. We need to go digital, right? And we've started both at the urban and rural. Rural introducing Save Mama. Save Mama is our rural emergency service and maternal transport, USSD and toll-free.
pregnant women.
Yeah,
and
supporting
delivery.
pregnant women. So we have a toll-free number and also a USSD dispatch, voucher generation, and validation system. So it's like, I'll call it like a local Uber, a community-based Uber, but not using Android phones, but more future phones. That's why we're using USSD and calls.
Yeah.
So that way, pregnant women in the communities can get
Is this
access.
kind of they are currently enjoying?
Yeah, they're currently enjoying in Gombe.
Right,
We
right.
just commenced February
Oh, I
1st,
see.
piloting in Gombe,
So
Plateau.
So within the next 3 to 6 months,
Well,
more places will be covered.
it will be, we will start making presentations everywhere because Nigeria, the most populous black nation, having such an innovation, I say, is something that the president, the coordinating minister would take to the bank as one of the reforms. Because I am noticing, opposed to popular beliefs, there's lots of acceptance for this community-based innovation. But now at the central level, I just need to expand my call taker capacity because adoption is increasing in the communities. And one thing SWAP has done, SWAP has really supported in one of our main challenges, which has been delayed reimbursement. SWAP has disbursed funds to the states. All I just have to do is confirm these trips at my call center and every month send a letter with the list of confirmed drivers and the vouchers generated to the states and tell them, okay, go ahead and pay these guys. And you see, that is something that is reformed. This is what reform looks like, right?
Because you look for because the essence of the reform is look for the bottleneck and just tackle there. You don't need to go and attempt to solve the whole problem. Yeah, and just look for the main bottleneck and remove it.
That's what this platform is for. Look at what it's doing and what defines and what exemplifies reform. So we talk of reform, but the public might not understand reform. You have to understand reform by understanding what was the status before. The status is you provide transport, provide services, you write your memos, get it through the channels. It takes time, right? The ministry process, it's a right process. It's in accordance with the financial regulation, but you are implementing an emergency situation. Emergency needs speedy action. And if what we've noticed over time is we're currently even implementing side by side with this digital system, a manual system. And we're getting lots of dropouts from I'm seeing it. We're getting dropouts from the taxi drivers on, my money is not coming. I have to go and pick people. But now with this, there's a short payment.
I'd rather go and carry yam.
Carry yam. So even there's some communities where we have 5 drivers registered. You call them when a woman is pregnant, ready for labor. Nobody's on ground because
they have other
things to go. We surely pay, but I'll tell you, it takes time and it's
for that class of operation.
Yeah.
Your cash flow is your lifeline.
That's why we need some legal framework development enables us to quickly pay like an Uber system. And that's the only way to get trust. But this reform is already on the pedestal of getting that done. We've spoken with Dr. Muntaka, appreciate Dr. Olumide of the World Bank, TTL, and lots of things coming up, all still under the leadership of the coordinating minister, Professor Mara.
So to close, I'd like you to just shout out some of your colleagues at work. Now, I know you've spoken about the big bosses that you're working with, but in the office, there are this group of young men, women, I don't know their names. Yeah. So I think you should use the opportunity to shout out.
Some of them are not young people. But I'll first shout out. First, let me shout out Dr. Lawal that is here. Yes. I call him the crazy genius, right? He's my Kanye West. Kanye West is very crazy. This is Kanye West. He's a genius. We're just holding the chain to tie him one day. But he's a genius. No, then somebody that always believed in me, Dr. Daya Deonju, former Commissioner of Health, Ondo State, and focal person and he's a national coordination program manager for MAMI. He always believed in me. Always told me I can do this and I can do this. He's one of my backbones. Then my twin, Dr. Ashiri, you'll soon see him here on this platform and let's compare if we are twins, but it's my twin, Dr. Ashiru. Then Amina, Ini, Zeya, you have all of them. These are interesting people within the SWAP family. Professor Linda Ugalahi, Kanyisola, right? Ola, the shy Ola, and Mrs. A, she knows herself. the new Yahoo in the house,
Hmm.
then everybody must give respect to Cyril, or else Cyril, I hail you especially. So it's a family. So the swap coordinating office is a family. You don't even know when time passes by.
Right.
You come here. This is what a
It's
reformed
exciting
team
that
looks
you
like.
missed out Lekki.
Wow, my second twin. Please, Leke has to be a Leke. Please, I'm sorry. Leke is one of us. Like, Leke is also. So I think there should be another episode where we sit down, three of us, and talk about our trip to Haydom. Then on this platform, I think we'll have some field visits, so you see the real character. So it's a good team of, I don't call eccentrics, geniuses, patriots.
Hmm.
They work all the nights to make sure we actualize the goal and help Nigerians and make Nigerians see the dividend of this administration, the President Bola Ahmed Tinubu
Thank you so much, Dr.
administration.
Doubra. It's been a very, very wonderful afternoon session with you. Thank you so much.
Thank you
And
very much.
we will come back in another 3 to 6 months,
Yeah.
to see how far you've gone with digitization,
Yeah.
to see how far we've gone with legislation. So even if it's something we should have started by then, and probably with a lot of feedback from states and communities, particularly on the digitization of services. Dr. Doubra,
Thank you very
thank you
much.
so much.
Bye.